Thank you very much, Jeff. I appreciate that. My name is Kelly Lake. I'm the Director of Strategic Alliances for Zenitel, out of the Americas, of course. I'm based in Phoenix, Arizona. And we're very excited to be part of this webinar, excited to share some solutions that we think are very timely today and really address some of the challenges that our healthcare workers, our healthcare community are really facing today as they spool up to deliver some services for the COVID-19 pandemic that are somewhat unusual in their normal course of work. First, to just address Zenitel. At Zenitel, we specialize in intelligent voice communication solutions, especially for safety, security, and healthcare, including intercom and public address solutions. You may know us as the manufacturers of Stenophone, which is our legacy brand, which has been the market leader in communications for more than 70 years. Our technology, we're not going to talk too much about the back end of the technology today because we really want to make sure that this is applicable to the healthcare challenges that are being faced today. But just by way of a little bit of an introduction, our technology really lives on a scalable, intelligent platform. We have the ability to connect our edge devices, whether they be intercoms or PA horns or other communication devices, in a number of different ways. The ones that we'll be looking at most today will be the ability to connect intercoms or PA devices via SIP to an existing voice over IP telephone network, or in an architecture we call IC Edge, Intelligent Communications at the Edge, where the devices can simply be connected through a very simple network, edge devices only, no back-end infrastructure, appliances, or servers required. All of the communication is facilitated with the edge devices, so you have very simple solutions that can be very quickly deployed as an IC Edge system, as just a simple independent intercom or PA system. If, however, the system requires more centralized management, a more robust cybersecurity features, or wide-scale integration, you simply layer into the system the new Intelligent Gateway ICX500 running the AlphaCom Enterprise Audio Communications software. This will allow the system to scale up to over 500 devices. You can have multiple nodes, and of course, enhanced integration and connectivity. And the Intelligent Gateway also provides us the ability to connect into the cloud for cloud services or into other platforms. But today we're going to be focusing primarily on the edge devices and rapid deployment solutions that would most likely use either SIP connected to your phone system or IC Edge as a simple independent system with edge devices only. So today we're talking about enabling clear communication while limiting risk of infection. Our goal, of course, is to provide solutions that reduce personal interaction within our healthcare system to protect healthcare workers from infection and conserve the protective gear. I'm sure we've all been watching the news coverage. We know that personal protective equipment is scarce and is running low in a lot of areas. And so our thoughts are that anywhere that we can deploy remote communication where the healthcare workers don't necessarily need to be standing in person communicating with folks visiting their facility or patients, then we have found an opportunity to protect that healthcare worker and conserve whatever protective gear they might have needed to wear in that situation. So this application applies to a number of different areas within the healthcare world. Isolation and quarantine rooms, where patients that have been diagnosed or are showing symptoms have been isolated, and where healthcare workers need to work with them or communicate with them. Drive-through testing, especially in the pre-screening portion of the drive-through testing, which can be done remotely but is often done in person today. Hospital admissions and the pre-screening process of who's coming into facilities, making sure that they are going into the right area of a facility and checking them to see if they're showing any symptoms. Field healthcare facilities, which are popping up throughout the United States to augment those healthcare facilities that are already existing. And of course, we're going to talk a little bit about interoperability as it applies to existing systems, especially in communications. The key features that need to be considered to make these solutions feasible and valuable in the field are, first and foremost, the ability to rapidly deploy this technology. Many of the solutions that our healthcare providers are putting together to do testing, to do pre-screening, are going up very quickly. They need to be very easy to implement, and to that end, our technology is especially well suited. As mentioned before, you can install any of our communication devices as SIP telephones on an existing voice over IP telephone network, or in a simple standalone IC Edge based system where you don't have any back-end infrastructure required, just a simple network switch, and this can be up and running immediately. At Zenitel, to try to facilitate and contribute to these efforts, we are also offering a pre-programming service for these smaller systems so that we can get just bundled solutions out. You just need a couple of devices. We can get them out to you. You can get them up and running as fast as possible. And that's something we don't normally do. But we want to make sure that we can contribute to getting these solutions to the people that need them the most as quickly as possible. The other key feature is clear audio quality. Zenitel has been known for years as the leader in the marketplace for clear audio quality. All of our IP devices have built-in noise reduction software, anti-echo cancellation, or echo cancellation software, and a high volume so that they can easily be used in especially noisy areas, both indoor in areas where you might have machinery or ventilators running, and also outdoors where you might have noise from vehicles or weather or crowds. So it's going to be imperative that if we are enabling our healthcare workers to communicate important information at a distance, that communication be crystal clear so that they can hear and understand exactly what the patient or the visitor is trying to relay to them. And then, of course, we need to make sure that any communication system within a healthcare facility is able to easily interface to their other existing communication systems, including radio, telephone, or nurse call. So we're going to look at a handful of specific applications that are really unique to today's situation. The first is isolation or quarantine rooms. Now, these are facilities that or areas that exist in most existing hospitals or healthcare units, but usually in very small numbers. So what we're seeing in the marketplace is, or what we're seeing in the world is an expansion of isolation areas, retrofits of existing rooms into isolation or quarantine rooms, and even field deployments of temporary facilities. Now, these are areas, of course, that are designed to limit the spread of infection for infectious disease. They have some very unique challenges in that healthcare workers, of course, need to don full protective gear in order to enter these areas to provide care for the patients. But there's some levels of communication that don't necessarily require personal protective gear or require the healthcare worker to enter the space. And so if you have clear communications from outside the area to inside the isolation room, you can have those conversations and communicate with the patient without necessarily having to go in and out of that space. It's also important that the patient have the ability to communicate out when they need to. And so an intercom system that allows for easy communication between the areas is paramount and is always installed in existing clean room or isolation rooms, but as they scale up or retrofit existing rooms into isolation spaces, they'll need to add communications into those areas. What's really important in these areas is that any devices that are placed in that room can easily be disinfected, wiped down, and so that requires some specialty hardware. Zenitel manufactures a clean room intercom station that is specific for this area and can be cleaned, disinfected, and does not maintain any bacterial or virus contaminants once it's cleaned. So in isolation and clean rooms, we're looking for communication inside to outside without breaching the clean room environment. These clean rooms are typically very noisy. There's typically a lot of machinery running. You might have ventilators running, or you have clean room HVAC systems that are filtering the air and maintaining the environment. You need an intercom station that can be easily disinfected, and it's important to be able to work with that station hands-free when needed. So you can add a foot pedal or an external button, something you can hit with your elbow, for example, that can initiate conversation. And again, this is all IP-based, network-based equipment. So you can have a simple clean room station on the inside of the isolation space and an intercom station on the outside or at the nurse's desk that and have those connected just directly into a simple IP network, and they're up and running. Isolation and quarantine rooms also have a need for high security. These are sensitive areas where we need to make sure that only those authorized to be in the area are there. So in addition to access control, when it's possible to deploy it, video intercoms have become very useful in these areas for making sure that the doctors and nurses that are authorized to be in these spaces can be easily vetted in and out of them. With a video image and a clear communication path, you can talk to the person, get their name, see their image, and allow them into the space. One of the challenges that we've seen in the news is that a lot of doctors and nurses, as healthcare workers become more scarce, a lot of doctors and nurses are moving between facilities. So this is a challenge for traditional access control deployments because many of these healthcare workers may not be enrolled in the standard access control database. So the ability to vet these people in and out of secure areas without them necessarily having capable credentials is very useful. You can, of course, record the video from the video intercom. It is on VIF Profile S, so that you can run it into the existing video management system. And we, in fact, bundle up a kit for this purpose called the TV3 kit, which includes this the black faceplate video intercom and a video master station that is pre-programmed and ready to deploy. That makes it very, very easy to just implement a quick one-to-one communication solution for these areas. The other area of very unique solution has been popping up is, of course, drive-through testing. So we know that wide-scale testing is needed and important, and healthcare facilities all over the country are scaling up their ability to provide testing as quickly as they can. One of the challenges here, though, is to deliver that testing without or while minimizing personal contact with the people that are coming to be tested. And so what we're seeing is drive-through locations opening every day all over the country, and they're being deployed in a number of different ways. The challenge here is that nobody's really had to do this before, so there really aren't a lot of wide-scale best practices in place. What we're seeing is that many times it's simply doctors and nurses grabbing a clipboard, putting on some protective equipment, and going out to the parking lot to try to deliver these services as quickly as possible. Of course, that requires all of the healthcare workers that are going to be out in that space talking to drivers to have full protective equipment, right? Which we know is at a premium today. Today, in order to get a COVID-19 test, you still need to be referred by a doctor and typically have an appointment. Some drive-through testing is being conducted for particular groups of people like first responders or healthcare workers. But in any of these scenarios, there's a pre-screening component to the queue or the line of cars where healthcare workers need to make sure that the person coming for testing has either been referred by a doctor, has an appointment, or is part of the community that they're testing for that day. This requires that somebody go to the car, the driver identifies themselves or shows that they have an appointment or a referral, and then they fill out some paperwork and then send them up to the front of the line to actually do the test itself. This is a stage, this pre-screening stage, is definitely an area where improvements can be made in terms of communication. You can see up in the upper right-hand corner that there's a number of areas where the drivers come in and they're not supposed to roll their windows down to minimize, again, the transmission of the virus. But that obviously makes it very difficult to communicate with these folks. So some healthcare workers are using bullhorns, or they're having to roll down the window and stand back. But in all cases, the communication is very difficult, especially when you're communicating through masks. If we were able to deploy a very simple but very clear and rapidly deployable remote communication solution, then we would be able to have these interviews and pre-screening communications done remotely. It would probably be faster because the person that they were talking to would be able to be potentially inside or away, maybe even talk to multiple lines, or you could have multiple operators. And it would also allow the drivers to roll their window down and communicate freely without having to be near anyone in person. So think of this like going through a drive-through pharmacy or a bank teller, or even a McDonald's drive-through, when you just pull up and you communicate with someone inside as that first stage of communication. So this is something that can go out very quickly, can be deployed on a mobile unit like a cart or a stand of some kind that they can move around and adjust as needed. All of the equipment that we have is also, because it's just standard IP, it's compatible with any wireless transmission options that might be deployed to make these even more adaptable to the areas. So you can use a wireless bridge, or you can use a wireless mesh network, or any point-to-point wireless solution for getting this communication back and forth. So as we look at drive-through testing, and we look at the pre-screening process to make sure that those folks are there at the right time, that they are eligible to have the test done, if we could remotely communicate and verify those folks meet the requirements for testing, then we would really save a lot of personal interaction and, of course, all the gear that comes with that. It'll be important in this solution to have audio projection that overcomes the vehicle noise, as we expect people would pull up and communicate with the vehicle running. And you also, of course, are going to have noise in the parking lot or any other environmental noise in the area. So being able to eliminate background noise so that the driver can be clearly heard, and then also have a nice, strong audio output so that the driver can clearly hear the instructions they're being given, becomes paramount. And of course, being able to install these in a mobile, on a mobile cart or stand of some kind, and compatibility with wireless solutions. We've also seen a trend toward pre-screening of visitors into the facility itself. We're seeing this in both hospitals and clinics and senior areas or senior housing facilities. And some of these are even coming up as mobile tent hospitals or mobile field deployed structures. You can see one here where people are being screened before they enter the hospital so that if they have symptoms of COVID-19, they're kept in a separate area or even in an outdoor location. But much like the drive-through testing, the pre-screening and how this is done is still is really just being done ad hoc by the facilities, and there really aren't great best practices around this. These are both pictures of pre-screening areas that I found in the news media. And you can see that in some cases, they're just doing the screening in person to talk to visitors, find out where they've recently traveled, if they have symptoms. Or in the case on the right, you can see at Jackson Hospital, they're just doing it with signs, right? Trying to encourage people that have symptoms not to proceed into the facility, but rather to turn around and, in this case, go back to your car and call a phone number. If we had a clear communication solution where someone could walk up to a designated area and communicate through a partition or to a remote location prior to being let into a physical area, a facility, then you would be able to reduce the amount of personal interaction required and issue more accurate instructions. So you could visualize something like walking up into a quasi phone booth, or think of what a box office window looks like, where you could come up and have an actual partition either right there between you and the person you're talking to, or again, the person that you're talking to could be located inside or in a controlled area. So as we do these interviews, again, we think about a simple intercom application. That intercom can be set up to automatically connect based on a motion detection, or if it's a vehicle-based solution, a ground loop. That way the person who's coming up to communicate doesn't have to physically push a button or touch the station in any way. And you could designate an area for pre-screening interviews so that you could issue instructions to people and visitors for where they can go and where they should be. You could validate symptoms, you could have a conversation, you could also have a video feed, of course, that allows you to have that diagnostic conversation prior to the person entering the building or personally engaging with a healthcare worker. Keep in mind that we also offer IP speakers and IP horns. So there's potentially going to be areas, especially if hospital or healthcare areas are, or people coming to healthcare facilities are continuing to increase. You could have areas where you might have a line or a queue or a crowd even that needs to be communicated to as a group. So an outdoor horn would be useful for this. And again, these can all be simply and quickly deployed. For those that are healthcare workers that are conducting these interviews, you could have a person in a designated area with a video intercom. That video feed and audio feed could come inside the building to a simple video intercom master station that could be located outside of the infectious area. At Zenitel, our video master station is based on a SIP phone design, which means that it's compatible with any number of standard headsets that are available on the market, probably already in the facility. That way, each operator could have their own headset. They wouldn't necessarily have to touch the device. And again, you can increase hygiene and limit the passing of the virus or any germs from one to the other. You can, of course, record audio or video as part of these solutions by either streaming that audio and video into a VMS solution, or Zenitel has an audio and video, simple audio video recording solution available. And of course, if you had an operator that wasn't limited by having to walk out and talk to people in person, they could monitor multiple locations, or you could have multiple operators. So you could have a call that rings 2 or 3 locations, and whoever picks it up first has that conversation. You have a lot more flexibility here, and again, keeping people safe. As hospitals and healthcare facilities reach their capacity, many of them are standing up field healthcare facilities that are mobile in nature and temporary. You see a handful of those examples here. Probably the most famous of these right now is the mobile hospital that was set up in Central Park. That mobile facility has 14 tents covering 50,000 square feet. It's designed to accommodate 68 patients, including 10 intensive care units. So these intensive care units will need to have all of the technology and communications that they would have indoors in these temporary units. So that means, in addition to ventilators and healthcare equipment, they need to have reliable communications, and you need to secure this entire facility in some way. So these field hospitals really have all of the demands of a standard hospital, but are being quickly stood up and quickly deployed. The other thing that's interesting about these field hospitals is that they're primarily designed originally for trauma type care, a wide-scale injury event. They're really not designed initially for contagious disease. So many of these field hospital facilities have had to be retrofitted to contain or the isolation space or the quarantine space, and the more we can reduce coming in and out of those spaces, the better. So in these field healthcare facilities, you really have all of these applications coming together. You have doors and entrances and restricted areas that require security, pre-screening, and clear communication. And then you have clean rooms, isolation rooms, and ICU units that need to have clear communication into and out of those spaces, and with a device that can be easily disinfected between patients. Most of what we've looked at so far, of course, is specific to today's challenges around COVID-19. But it's important to remember also that Zenitel provides solutions for healthcare every single day for identifying visitors into various patient areas, receiving emergency calls through blue light assistance stations like the one pictured here, integrating into other communication systems, and of course in clean room environments. But you also can use the Zenitel system for automated announcements on alarms, like if patients are wandering or in an emergency. It's applicable for PA, emergency or operational, especially out in outdoor areas. Offers integration to access control, video, and we often find it used in conjunction with panic buttons to open up an audio channel for easy and clear communications. Audio monitoring is a very important component in sleep labs, procedure rooms, and isolation spaces so that you can hear and monitor what's going on in the area. And of course in lobbies, kiosks, and elevators. So keep in mind that you have all of these different ways that communication is critical in a healthcare environment, in addition to the new challenges that are presenting themselves based on COVID-19. We've mentioned interoperability is critical. Most healthcare facilities have extensive communications already in place, and those communications are designed for different types of communications with different people. Nurse call, for example, is the ability for patients to communicate with staff. Intercom is typically used for staff-to-staff communications. You have phones, of course, for external calling in the telephone network, and radios to communicate with employees and officers. So it's important that all of these systems can work together. And if you have a call, say from an intercom, that needs to go into your phone system or out to a radio, you can interconnect those systems. It's also important, when available, to integrate these communication systems into a command and control software. So today, we're looking at RS2 technologies. With an RS2 system in place, you can integrate both the IC Edge platform and the AlphaCom platform so that you can control calls and announcements within the RS2 user interface. You can identify the location of those calls and paging zones on the mapping software. All of those calls will go into an audit trail on which you can run reports. And of course, it can trigger events in other systems, like video, or you could have a biometric sensor that triggers a pre-recorded message, for example, or any other interaction between connected systems. And then, of course, you can have a door opening command that does not necessarily use the relay that's on board the intercom at that door, which, of course, is, if it's in an insecure area, might be breached. You can open the door through the access control. So I encourage you, if you're interested, to contact your RS2 regional sales manager, as well as the Zenitel team for more information. So to summarize, there's really 3 key features that we want to make sure are present in any critical communication solution, especially in today's environment. One is making sure that audio quality is there. We need to make sure that everyone involved can hear, be heard, and be understood in any environment. We need to make sure that you have integrated communication so that intercom, PA announcements can integrate with existing communications platforms like telephone, radio, or nurse call, and integrated security platforms so that the communications, the events can be logged, they can be traced, they can be represented on a map, and the video can be recorded. So with that, hopefully we've sparked some ideas. We at Zenitel are really looking to help. We really want to help communication, help facilitate communication for those that are on the front lines today, and help protect the workers that are out there every day working with patients and visitors and staff.